medicine is moving towards the reality that kids aren't mini adults. Their conditions and diseases may have different origins and require different treatment. It's especially true with cancer.
Pediatric cancers are very different from adult cancers. In general, most of the cancers that you see as an adult is usually a product of what you've been exposed to in your life. A good example of that would be obviously tobacco. With kids, the majority of cancers are usually of a genetic nature. While you were developing, something happened.
That's fueled the field of pediatric cancer research. Children with cancer are looked at as a study group and each child a part of the study, examining treatment protocols and outcomes. The biggest beneficiary is ALL leukemia, the most common of all kids' cancers.
We're talking about an improvement from less than 10% in the 1960s to over 90% in 2010.
Kids' cancer is still a work in progress. Children with other forms of disease don't fare as well. So pediatric oncologists are collecting data from each type to study it in the way they did leukemia and hope for similar success. It's taken this long because there are fewer cases.
There are some tumors that are more rare, then those will take much longer because for you to get enough patients that you treat the same way, you have to get a certain number. And if it takes more than 5 to 10 years, it's very hard to do a research study.
Brain cancer falls into this category. For tumors in the brainstem, outcomes are poor. Neuroblastoma is also under scrutiny.
The number of children who have cancer that are on research protocols in the 80 to 90% range. When you look at adults, the number of adults that have cancer that go on research protocols, the number is usually around less than 10%.
The promise lies in a growing body of research. For Lee Memorial Health System, I'm Amy Osher.